for about 15 years. I have been in Florida for about 12. I have to apologize a little bit. I had an emergency at the office getting home at about 11 o'clock last night. So I sent my wife photos and talking points and all that. So I'm guaranteed she's going to put some embarrassing things about me in here. But we're going to get through that. So. All right. So I was born and raised in Seattle, Washington. I was there until I was 24 years old. I was raised in a family of healthcare providers. My mom was a nurse practitioner. My dad was a periodontist, a gum surgeon, placed implants, all that stuff. And my uncle was a pulmonary doctor. I worked in the hospital circuit in Seattle. I currently have two practices, one here in Boynton Beach off of Woolbright Road, and one in Fort Lauderdale off of Las Olas, and work 5 days a week. And I have two kids, and I'm married to an attorney who is now, she's a recovering attorney. She's now not working as an attorney anymore and working in the family business. So we'll talk a little bit about that. The business is outside of dentistry. So kind of fun facts about me. I played college football at University of Washington from 2001 to 2005. I played fullback and defensive end. Had some good years there, had some bad years there. But as we were looking through photos yesterday, I realized that I'm becoming a has-been. I got my jersey here up on eBay for not that much money. And so my wife had a little bit of fun with that one. And also my rookie photo here. So that was right out of high school when we first reported to camp. So yeah, it was fun. I mean, good experience. It teaches you a lot of discipline, how to make sure you're getting your grades and, managing your time and all that. So I encourage all y'all to get involved into either sports or extracurricular activities. It makes your resume better and more enticing. And feel free, guys, if you have any questions or anything, I'm not the guy to wait until the end. If you have any questions, feel free to raise your hand and I'll answer my questions as they come up. So, okay. Oh, nice tree. So I'm a big fisherman. My wife put that up there. Pretty cute. So I try to travel. Like part of keeping good mental health is getting away and doing things. And I like to get away and fish with friends and family and do things, do that outside of dentistry. Kind of keeps the brain clear and fresh so you can do your best and be your best. So a couple of these are in Cabo San Lucas with the fish here and here. My wife and I went on a 10-year anniversary trip to Alaska. This was her with the salmon and my buddy Jeremy. And this is my dental classmates. We went to Alaska for one of my classmates' bachelor parties, and because we're old, we just fished and had a great time. So I try to, like I said, I try to get away about twice a year to do that. I just got back from Seattle, went fishing with my kids, 10 and 13 years old. Had a great time. So, all right. So University of Washington, like I said, 2001, 2005. Majored in neurobiology. Very challenging with sports. Again, it kept me focused when I was in college. Didn't have a lot of time to mess around too much, but in the end, it made the journey in dental school a lot more palatable and manageable with time management skills and all that. Boston University. This is a new picture. My school definitely did not look like that when I went. Renovated. The school was much older than that when I went because I'm old again. Yeah, so I was there from 2007 to 2011 in Boston. And I'll just mention right now, I took a year off between college and dental school to figure out what kind of healthcare provider I wanted to be. So initially I was going to do neurosurgery. That's what I wanted to do. And I kind of got talked out of it by my uncle. My uncle was a pulmonary surgeon in Seattle, and he was talking to me about the struggles with insurances and insurances not paying for patients' care with the ideal care and all that, and how frustrated he was with that and how the direction medicine was going. So I decided to check out dentistry instead. Again, it's a family business. Assisted my father for about a year, and then went to dental school. So I really enjoy it. A lot of good things about it, and we'll get into that. No questions yet, huh? So these are the two practices. Boynton Beach is on the left, Fort Lauderdale's on the right. That's pretty much it. Oh. Doesn't have much talking point on it.
Maybe if we hit it again.
The arrow. She really set you up for.
She really did. Yeah.
I have a question. So you
Sure.
How do you manage two offices?
I have an associate in one, and I manage my time between the two. So the Boynton Beach office is 4 days a week, and I'm 1 day a week in Fort Lauderdale. But Fort Lauderdale is a relatively new practice, and the guy that I bought from, he's there 2 days a week along with the associate. That's it. Get a time out for a second so I can see if I can get the talking points, because I have a few up here, and maybe that I can just freestyle it, which is cool too.
Yeah. Or else we could just like do questions from the kids.
No. Let me just talk a little bit about dentistry. So,
Okay.
so part of what I really like about dentistry is I like to do things with my hands. I grew up doing woodworking and that kind of thing, and it gave me opportunity to continue with that skill. Again, you're working, for lack of better words, in a 2x2 hole, right? You're working, and you're doing really fine work. And it gave me an opportunity to do that. But on top of that, you really change people's lives. I mean, the first thing that you see when you meet somebody is you look at their eyes, you look at their teeth. That's pretty much how you greet somebody, right? So if you're able to meet somebody and you can have them put their best foot forward, that's really what my passion is in my business. So what I wanted to talk about with this picture was about cosmetic dentistry, and what cosmetic dentistry is basically making your teeth look better, right? And what I want to stress is that the most cosmetic smile, at least in my eyes, is the one that's well taken care of and natural teeth. Maybe he has some braces done to get it straight or whatever, but it's not the veneers or anything like that, right? So it's really important to take care of your teeth, to do the things that prevent oral disease, because at the end of the day, it's all connected to your body, right? Infection, inflammation in your mouth, all that stuff flows in your bloodstream and affects lots of different parts of your body. And so just maintenance and going to see your dentist, and don't believe all the TikTok stuff. There's no purple gel going to whiten your teeth. That's just color canceling stuff. So just going and making sure you do the normal things to make sure you keep your teeth healthy and get your checkups and cleanings and all that, and have a healthy smile for a long time.
I have a question.
Sure.
Speaking of TikTok,
Oh, look, it showed up.
a lot of healthcare providers are using social media to kind of like introduce their practice to potential clients, as well as bring awareness to different treatments and issues. What do you think about that? The use of
I think it's good. It's just another platform to get information out there, and educating patients. I mean, I always say the best patient and educated patient. You kind of have an idea what the issue is, and you kind of know from what you're seeing, kind of the route that you want to go, and we can, as the healthcare providers, our goal is to guide you, the direction that's going to be the healthiest for you to still accomplish the goals that you want to accomplish. So yeah, I don't think it's a bad deal at all. Go ahead.
What do you think about oil cleaning?
So it has its merits and whatnot. Do I think it is kind of the be all end all for gum disease? No, but it helps. It helps. I wouldn't do that and not do the other things like brush your teeth and floss and go see your dentist and do all that stuff. But it has it shows to slow down the progression of gum disease and inflammation for sure. Anything else? No, okay. Okay, so talk about challenges of my career. Honestly, the number one thing is people don't love seeing the dentist, right? So I come in, I hear it multiple times a day. Man, I love you, Dr. Eriks, but I hate going to the dentist, right? So this is the first hurdle that I got to get over every single day, right? And it takes people a lot of time, especially with new patients coming in, to realize, okay, it's not as, bad experiences in the past and all that. It's not like that. They're comfortable with where you are. And so that's another thing too, is find somewhere where you're comfortable, with the provider, because that's number one. You got to be able to trust your healthcare providers, and that your health is their number one priority. So, and again, what dentists do, and we talk about cosmetic dentistry, if you either are taken care of or you've had issues in the past, fixing your mouth can become pretty expensive. So not only do they hate coming to see me, but it can be expensive. So we talked about the connection between oral health and your overall health, and taking your oral health seriously, so that you don't have a lot of the systemic issues that can happen because of chronic inflammation, infection in your mouth, lots of connections to diabetes and chronic inflammatory diseases, cancer, that kind of stuff. So it's very important to make sure that's all kind of connected, and that patients understand that. And again, having them take it seriously sometimes can be an issue. And people, again, because they don't take it seriously, they come see me when there's a problem. And they call me on a Saturday and say, "Oh, Dr. Eriks, that tooth you've been talking about for 2 years, I think it's infected." Yeah, taking up. So getting over these kind of hurdles are most often my daily challenges. The one I did not put on here is, the number one thing that the failure in medical school or dental school is they don't teach you how to run a business. And if you're at a place where you own your own practice, it's a business, and you got to learn how to run it, do payroll, do taxes, all that stuff. So when I originally bought my practice, that was a major challenge, learning how to do all that stuff. So I hope that they're doing more of those courses for students. Now, I don't know, hopefully they are, but if not, they should, because if you guys go to medical school or dental school or whatever you so choose, you take those courses on your own to make you more successful on that side of things. So. All right, so who should consider dentistry? Well, again, gotta love helping people. Again, people come in and tell you that I hate seeing the dentist, and you got to get over that hurdle and make them love that you love helping them. So enjoy science. There's a lot of science involved with dentistry in terms of dental materials, learning how to anesthesia work, acid bases, all sorts of stuff that you got to understand to make sure that you're doing the right thing and providing patients with their correct care for what's going on. Again, good with your hands. Again, you're working in a small place, teeth are small, and you're doing very, very detailed work. But it's very rewarding when the results are done and patients are happy. You gotta be patient with people, and they don't like seeing you. They think dentistry hurts, and it doesn't have to, right? So again, if you spend the time with people and do treatment that doesn't hurt, and they understand that, they get over their fears. That's also a very rewarding aspect of what I do, getting people over that hurdle, so that they do come and do routine stuff to keep their teeth healthy. So enjoy problem solving. There's always problems in any healthcare profession. You got to diagnose and treat. Certain things aren't cut and dry. You got to work through different paths to figure out what's going on. And once you get there, and you get somebody out of pain, or somebody's actually keeps getting canker sores, for example, and you figure out they got an allergy, or whatever. You kind of work through all that, and it's rewarding at the end when you get to cure somebody, really. And not afraid of it. There's a lot of split, a lot of blood, not a lot of blood, but some blood. You got to be comfortable with that because it's the mouth. It's not a dry environment. And, so that's it, really. And again, I talked about, the first thing you notice when you see somebody is their eyes and their teeth, and being able to provide the care that somebody needs in order to keep everything healthy and nice and neat and clean. To allow them to put their best foot forward is what's very rewarding, and keeps me going every single day. So, all right. Well, sorry, those 2 slides in the middle were blank. I promise there was stuff on there. But
Good question.
Mhm.
So, you played college sports
Mhm.
and you were in medical school at the same time?
no, it's pre-med.
Pre-med.
Yeah.
Okay, so do you have any advice for anybody who's considering possibly going to college to play a sport and also, have a pre-med, undergrad? How to balance that? Because I think both of those are pretty intense.
Yeah, they are.
So any advice to anybody?
Sure.
who's
Yeah.
considering?
It takes time, and you have to learn how to manage your time the best way that works for you. Everybody's different, how you study, how you put everything together. But you go and you want to do something like that, you can't. It's just that's all you do. You go to school, you do your work, do your sports, wake up, repeat. I mean, that's the secret for me. I diagnosed with ADD when I was a kid, and it was a challenge, getting everything done, and it takes me twice as long to learn something than most people. So it just was extra time studying, and also probably kept me out of trouble too. So good.
What are the highlights of the job, like the benefits of like living your practice?
Well, the benefit is that you run the show, right? And what my favorite part is honestly get to know my patients as a general dentist. It's like most specialists, they'll see a patient, get the care done, and then they get sent back to the general dentist. So I get to be that guy that gets to see kids grow and families develop and become family with my team at the office. So I think all those things, the relationship building is what's outside of the work that I do, is probably the most rewarding thing about it.
I kind of got like 2 questions.
Sure.
Does your dentistry work with kids?
Yeah, because my dentistry work kids. Yes, I see as a general dentist, I choose to see children. Some general dentists don't. When I graduated from dental school, I did 2 years pediatric dentistry at a health clinic, and so I got a lot of experience on that side of things. So yeah, I do treat the entire family.
All right, and then like following that, do you think you are able to get like a prejudgment based on the adults or the kid themselves to this healthcare?
No, I wouldn't say a prejudgment. I mean, we take all our diagnostic. Sorry, I should repeat the question. Do I have prejudgments based on adults or kids? People that are online that can't hear the question when they come in. But no, we do our diagnostics. We take our X-rays, exams, that kind of thing. You never know. Until you get in there and you actually do the diagnostic work to figure out what's going on. It's pretty clear most times what needs to happen, whether it's dietary for kids, especially. Sugar is a big problem. Gummy bears, all that kind of stuff. Not brushing your teeth, the whole gamut of things. But yeah, so it's hard. So, but yeah, do your diagnostics and then treat your plan from there. Does that answer your question?
Yeah.
Okay.
Who's more challenging to work with, adults or children?
Depends on the adult, depends on the kid. As a general, I mean, kids are pretty easy. They're pretty easy to work on. I just in my experience, the kids get worse when the parents sitting in the room right? It's better if they're alone and, do their own thing, so. But it depends on, it really does.
It's years about the school. How did you determine the path you wanted to go on?
Yeah, so, yeah, I assisted my dad for, about a year, not 2 years. And just made sure that, I like dentistry, like the, all the different nuances and aspects of it. And I'm very thankful that I had that opportunity, to do that. I think that I don't know if I would have chosen the same path, and I definitely am very happy where I am, now with my career, so.
I have two questions.
Sure.
First question, what is your biggest piece of advice for running your own business?
The healthcare business?
Yeah,
Or just
your own
generally?
practice.
My own practice. Yeah, I mean, honestly, you just got to learn, take courses, get to know the nuances of any business, right? Again, running payroll, taxes, that kind of thing. You don't necessarily have to learn marketing or anything like that. They have, different businesses that do that for you if you need it and that kind of thing. But just learning how to take care of your employees, do retirement plans, 401ks, that kind of stuff. That's one thing that I wish that I had in school that I didn't, and it was kind of unfortunately learning on the fly. Having a great accountant, she's wonderful, but she whipped me into shape. So we figured it out in the end. But I would say getting that knowledge before would be huge help. What was the other question?
My other question was from patients that are like resentful, not resentful, but like uncomfortable with going to the dentist. What are ways that you help like calm them down, I guess?
So what I have found that helps the most with people that are nervous is just communicating with them, talking with them, talking about different stuff, not dentistry, talk about the kids, talk about whatever. And I have very talkative assistants as well. So I think just getting their mind off of what's going on is a huge help. There's always those patients that are super nervous. You can't really, they don't want to talk to you. They're like, no, I just want to get here and get it done. There's different, there's nitrous oxide, there's different stuff that you can use to kind of like calm them down. They don't have that experience. And at the end of the day, that's what we're here for. We get the job done and make sure people have the best experience with it.
There's just a question for me on here.
Yeah.
How many years of schooling did you have to do for your career? And do you have to go into clinical/rotations for dentistry like a typical doctor?
Okay. So including undergraduate, get my Bachelor of Science in college with 8 years. After dental school, depending on the state where we practice, sometimes they'll make you do a 1-year residency, hospital-based residency. I did not have to. I went to Washington State after school for about 2 years before coming down to Florida. Florida also did not require that year of residency like New York. I think maybe Boston, Massachusetts, I think maybe. But there's a few states that require a 1-year residency. Highlight of my career, the number one highlight. That's hard to say. I think just kind of watching development, and this is a pretty basic answer, so I apologize. But watching the growth of my practice and the the happiness of the staff and the patients, kind of makes me think I'm doing things right. But yeah, I mean, I think just watching that kind of success has been very rewarding over the years. So I know basic response, but there's not. I couldn't say one thing that would make sense, really, to be honest. Yeah.
If you have social media, like, or you post it, plan on maybe one.
Sure. Sure. So do I have a social media? Yes. So the answer is what we talked about before. There's people that do that, right? So no, I don't post my own stuff. We do send pictures to our social media marketing staff, and then they'll post based on lots of things, time of day that's right, and all stuff that's way above my pay grade. So does that answer your question?
What interested you got into neuroscience and the field of neuro?
What got me into that? I always wanted to be in the healthcare profession. And then when I did my undergraduate degree and going through like the basic sciences, I just kind of followed the path that I liked the most. And it ended up being neurobiology. And I also like smaller educational settings. I just think it's more personal, and I personally learn more. And there was, I'm totally guessing right now, but less than 30 students in my major in college, which was it was a nice environment. Again, friendships and all that stuff that developed. But yeah, just kind of following your passion. But you gotta get into the basics first and find your path that you like the most, and follow it, and that's it for that.
What are your responsibilities?
What's that?
What are your responsibilities?
What's the responsibilities of my career? Keeping my patients' mouths healthy. That's the main responsibility, and keeping people out of danger. Again, at the end of the day, the patient makes their own decisions. But if I'm like, hey, you got an infection here, this is how you fix it.
I have another question. What's the scariest part of your career?
Scariest part. Honestly, it's I would say the scariest part is when patients don't listen to what's going on with them, and the fear. Because listen, at the end of the day, an infection in your mouth it's gonna be life threatening. I'm not gonna make it any lighter, and that can be scary, especially when you're dealing with geriatric populations and patients that aren't the healthiest to begin with. Again, my goal is to make sure that I treat people so that they're the healthiest they can possibly be. So I think that's the scariest part. People that come in, they ask for my opinion, and and then so it's that fear of what can happen afterwards. What was the most difficult experience in the story? It's tough. Well, I think the most difficult part for me was the first 2 years of dental school. I think medical school is the same, but you go through all 4 years of sciences that you did in undergraduate, in your bachelor of science or whatever. You go all that stuff again into 4 years of science in 2 years, and then you get into your clinical stuff after that. And like I said before, it takes me a little bit of time with my ADD and all that to study and get everything. It's about double the time for most people. So all that work was a little difficult. We got through it though. I ended up being third in my class, so I ended up working out well. But difficult. Time management is the main thing. So,
I want to know what you expect in medical school for like
what can you expect?
Yes.
It's definitely going to be tough. You expect it to be tough. Expect you to, it's a lot of hard work. Very rewarding work. You learn a ton. And just listen to yourself. Listen to because there's different specialties within dentistry. So, like we talked about neurobiology, right? When you're going through your school and all that, just pay attention to what you like and kind of follow that path, because at the end, what you do for the rest of your life, So it's not really an expectation, but it's more of a guidance thing. But yeah, it's a lot of hard work, and expect to have to figure out time management skills and And you have to have a social life too, but you know, how to manage that so you get the most out of it. It depends on the day. So Mondays and Tuesdays, I have specialists at my office. I have a root canal specialist, an endodontist that comes on Mondays, and I have a periodontist that comes on Tuesdays. Does all the surgery at the office. So those are our craziest days, the first few days a week. But no, it's pretty chill. I don't, you know, we have a busy schedule, but I also don't, I'm very OCD about my work. And so I want to spend the time making sure it's perfect. So I don't overload my schedule. So it flows pretty well. You know, it's not too crazy. So.
Like since you have your own practice, is it like less hands-on work from when you didn't have your own practice? Or is
No, a lot more. It's a lot more because you're not only doing the dentistry. I'm the only one doing dentistry in my Boynton Beach practice. So besides the specialists that go on Monday and Tuesday. So no, I think there's more, and I got to do all the administrative stuff too, and all that. So kind of double the work, I guess.
Was there ever a moment when you completely stepped into your career choice and that you could
No, not really. I mean, it gets hard, but any profession gets hard at times and challenging with work-life balance and that kind of stuff. But no, I've been pretty happy with what I did, which is why I took a year off and made sure that I was going down the path that I wanted to be in the rest of my life. So, it's not to say that they can't happen, it just hasn't happened yet.
When did you decide to open your own practice?
You know, after my first 5 years of practicing dentistry, you know, there's certain things you agree with and certain things you don't. I mean, not every dentist is the same, right? And so when you're working for somebody else in their practice, you don't have full autonomy really to do what you want. And so that was the major thing that pushed me to my own space, is that there's none of that. You know, you can do what you need to do and do what you think is best for the patient.
The online audience wants to know, how has your job changed since you started, tools and tech wise? And do you have to take any courses to keep up with the changes?
The answer is a ton. Again, I graduated in 2011, so it's been 13 years. We took regular x-rays back then. We didn't have digital x-rays or anything like that. So none of this 3D scanners or milling machines or any of that stuff. 3D printing, like all the models of people's teeth now are all scanned and 3D printed. And you know, some people still do it, but you know, the stone models, all that stuff, it's all digital pretty much now. So learning that has been probably the most not difficult, but you just got to follow it. Yes, you take CE courses. In order to renew your license, you have to take CE courses. So we do quite a bit.
So how did COVID?
Oh, God. Yeah. COVID was a mess, to be honest, for many reasons. Not only was it a sad deal, but it shut down basically the practice of dentistry for quite a while. You know, I'd say, I don't remember exactly how long it was, but 2 or 3 months, we could only do emergency services. And you know, I have full staff relying on, you know, me to be able to practice and provide paychecks and all that stuff. And you know, the government stepped up and helped out with all that stuff, but it was very challenging. Very challenging.
How was it getting like all the extra PPEs, because you know COVID being a respiratory thing and you're dealing with the mouth and all that? How was that?
You know, we have pretty large distribution companies that we get our PPEs from, and they did a lot of the heavy lifting, finding, you know, big supplies and masks and the correct one with the 95 and 95, yeah. You know, making sure we had that, we had our, you know, garments that we wear and all that stuff. So that portion of it wasn't terribly difficult. we did have a group order at times, like I had to fool with local dentists and medical providers around and say, hey, let's buy the big batch of, you know, thousands of masks and we'll split it up and give you that. But yeah, I mean, I think people worked really well together during that time. That was, you know, that. Pretty cool, actually. That doesn't have nothing. People aren't necessarily good at working in groups.
Do you perform surgeries?
I do, yeah. Certain things. So I am a firm believer in specialists, right? So I always tell people that you know, my general patients like, oh, why don't you just do the work? You know, I need this implant, all that. I'm like, do I know how to do it? Sure, I know how to do it. But the guy that comes to my office does it every day. He does hundreds of them, you know, and they go to school for that. You know, they go to extra school in order to do that. So I would tell my patients, it's like going to your general physician for a cardiac issue. You're getting to a cardiologist if you have a heart issue. Right? So it's the same situation. So I do, yes, to answer your question, I do some, but not fun. Yeah.
Where do you see yourself in 5 years? And do you possibly want to open up a third?
No, not a third place. 2 is enough for me. Again, I'm pretty hands-on with my practices and very kind of OCD about how I like, you know, stuff ran. So it just sort of smooth and it's a lot of management. So the third practice will probably kill me, to be honest. But where I see myself in 5 years, probably where I am now. I enjoy maybe working maybe one less day a week, but I enjoy what I do. So, you know, I don't really see that changing much in the next 5 years.
What is your average salary?
My average salary? Depends. Depends on the year, depends on expenses. Like right now, I just got done doing a huge remodel of the whole practice. So this year is probably not going to be as good as other years because a lot of money went to that. But do well.
You give them a starting salary for
Yeah.
entry level.
Okay, there you go. That's a better question. That's a better question.
How much do you get?
Yeah. I would say around 200,000 probably. Getting out of school, 250,000 probably. It depends on it depends on where you are, the location where you're practicing.
So a lot of light bulbs going on. Dentistry.
Yeah, there's
There's a good question for the online.
Yeah.
audience. What do you look for when you're hiring someone?
Personal skills. You know, I think anybody or most people can learn the job. But for me, I think that what's most important, and I've hit on this before, is that my staff's ability to connect with patients. So definitely interpersonal skills are kind of the number one priority for me. And I think the rest can be learned, to be honest.
What do you think about wisdom?
On a high level, don't love them. Most people don't have enough space in their jaw for them. So they end up causing more problems in the future, right? With not being able to clean them, causing cavities in the teeth next to them. In some cases, losing both the wisdom tooth and the molar in front of it. Have I seen people with perfectly, you know, erupted wisdom teeth that they keep clean? Absolutely. Absolutely. But it's just not a norm.
Do you use yourself?
It depends on the patient, depends on locations of them. Sometimes the wisdom teeth are communicating with the sinus on the upper, there's a good nerve that runs through the jaw on the bottom. And sometimes they're in communication with that. In which case, I send those to oral surgeons, but you know, they're routine, yeah, for sure.
What's the biggest or most common misperception about working in the healthcare field?
That's a good question. I'll have to think about that for a second. I think I mean, the healthcare professions, it's a difficult profession to be in. There's a lot of hard work. You know, maybe a misconception is that, you know, maybe that the salary is kind of easy, but I don't think people think that. I don't know. That's a hard question because I think everybody respects their healthcare providers. You know, they pick their healthcare providers because they're comfortable with them. And so I don't know. I don't know what a misconception is. The question. I have to think about that for a little longer. Yes. Yes. No, it's not common. It's even what 13 years probably happened 3 or 4 times, but it's pretty easy to get back to them. You know, work on cause and yeah, that issues.
Do you have any like dental hygiene recommendations that like maybe like not a lot of people do?
In terms of like practices at home,
Sure.
you know, the biggest I think thing that everybody misses is that they brush their teeth and they don't brush their gums, right? So like I've always find a lot of plaque built up on people's right between where the tooth and the gum meet, which causes a lot of gum inflammation and all that stuff. So I'd say focusing, you know, not only brushing your teeth but getting down on your gums and flossing. There's so many people that don't floss, and it's such an important thing to get between because you can't brush between your teeth, right? So you got to get that plaque off as well. And that's where cavities start most times is between the teeth. So.
Do you think that dental hygienists and
It depends on the state, to be honest. I mean, there's Washington State where I'm from, they're paid very well. Florida's pretty average, you know. There's certain places where they definitely are, for sure. They do a lot of work. You know, they do a lot of work. So, and I personally make sure that that's happening. Yeah.
I have 2 questions. First, what do you think about charcoal degradation?
You know, activated charcoal, there's a lot of things for it, you know, that are good for you. At the end of the day, any toothpaste is good as long as you get the plaque off the teeth. You know? So whether you're doing charcoal toothpaste or, you know, fluoride, people that have high cavity risk, there's a lot of research, and again, it's very controversial with the fluoride these days, but you know, topically, fluoride does changes the crystal structure of your teeth and make it actually harder. So, clinical toothpaste can definitely help that way, but the over-the-counter stuff, as long as you get the plaque off your teeth and you're brushing twice a day and doing that. You're talking about the whitening aspect of it, though. Yeah, I mean, most toothpaste have pumice in it. Charcoal is kind of rough as well, so getting stains off your teeth helps with that as well. But so does most toothpaste that have pumice in it. Got another one.
What do you think is like the safest way like to whiten teeth?
I mean, over the counter stuff is safe. You can do like the crest whitening strips, all that stuff. You get more immediate results going to the dentist to do it. The stuff, the gels that we use are much stronger. And we have to put like barriers on your gums because the stuff can actually burn your gums if not done properly.
If you use all that stuff for like whitening teeth, do they become more sensitive?
Yes. It definitely can become more sensitive. So you got to gauge how white you want your teeth versus any discomfort that you have, because that definitely happens, especially with some of the clinical stuff too. Zoom whitening for me, I stopped using it a long time ago because I had to give people ibuprofen beforehand to whiten their teeth, and I thought that was a bit of a kill. So I stopped using that a long time ago and used a couple of different systems that are much better for that.
What was your most memorable experience in your career?
Probably in dental school when I got to treat my mom.
Oh, that's cool.
Yeah, but she had a couple of different issues that I got to take care of. And then I see a couple, most of my family members have people that fly in from Seattle and for major work, not cleaning and stuff, but if they need any work done. But yeah, I think that was probably it. I'm sorry, I can't hear what you said.
Do you agree with how high on?
Well, this is a delicate dance, because we're constantly fighting with insurance companies to get reimbursed, right, correctly. So if you just do a filling, for example, say it's $100, right, and you the insurance wants to give you $50 back on that filling, right? So if we submit $50 to the insurance company will be like, oh, okay, well, that $50 reimbursement is fine, right? When it's really not. Composite costs more than that kind of stuff. So we constantly are balancing our prices with trying to get the insurance to increase their prices, because all of our costs are going, especially since COVID. I mean, lab costs, materials costs, cost of masks, blood, and all that stuff has gone way up. And fortunately, so does the cost of doing work in order to keep the business going. So
Do you think it's normal to have like a medical major in college and then completely kind of pivot away from it when you're going to medical school?
you said not have a medical major?
No, like have a medical major, and then like it's kind of different from what you want to do in school.
No. I think it's important. You know, obviously you have prerequisites you got to do in undergrad in order to apply to medical school. Right? So you got to make sure that you get all those prereqs done. Yeah, as long as you're well-rounded, you do well in school and all that. I mean, that's what people want to when you do your interviews for medical school or dental school or whatever. They want to see a well-rounded person that's able to have time management and all the stuff we talk about, so they know you can be successful. Yeah. But no, and definitely follow the path that you like the most, and if it's not the right one, definitely.
All right. I think that's it. Let's give him
Cool.
a very